Cancer is the #1 cause of death in Hong Kong, and cervical cancer is one of the most common cancers among women. According to the statistics of the Hospital Authority, 520 women in Hong Kong suffered from cervical cancer in 2019. Delayed treatment might be dangerous. The survival rate for stage 4 cervical cancer is only 16%. Since most cervical cancers are caused by HPV, it is important to get vaccinated against HPV as early as possible to prevent the disease from occurring. Who are the high-risk groups for HPV infection, and how often should HPV testing be done? Do men need HPV vaccination? Watch the video now to find the answers.
Bivalent HPV vaccine provides the best protection. HPV is a group of more than 100 different genotypes of the virus, which at least 14 are cancer-causing, also known as high-risk types. Two HPV types, namely 16 and 18, cause 70% of cervical cancers and precancerous cervical lesions. Therefore, the 3 HPV vaccines currently registered in Hong Kong, namely the bivalent, quadrivalent, and 9-valent ones, are mainly designed to prevent these 2 types of HPV virus. The higher the valence of the vaccine, the more types of HPV can guard against.
Yes.
As for the choice of these 3 vaccines, experts say that the bivalent and quadrivalent vaccines are equally effective in preventing cervical cancer, as they can both protect the recipients against HPV types 16 and 18. In addition, the quadrivalent vaccine protects against HPV types 6 and 11, which can cause genital warts. The 9-valent vaccine protects against 5 other high-risk types of HPV in addition to the quadrivalent one, and has a 90% protection rate against cervical cancer.
Are condoms 100% protective? Those who already have sex can also get vaccinated. The HPV is mainly contracted through sexual contact, and people who have sex are theoretically at risk of infection. The HPV vaccine is a preventive one, so it's safest to get it before you have sex. However, even if one has already started to have sex, he or she can also get vaccinated. For example, people who have already been infected with HPV type 16 can still be effectively protected against the other types of the virus after the injection. Even though wearing condoms can reduce the risk of HPV transmission, it doesn't mean 100% protection. This is because HPV reproduces mainly in the epidermis, and condoms only cover part of the skin. The HPV vaccine is mainly for the prevention of cervical cancer, so many men might have the misconception that they don't need to get vaccinated. But the truth is, men can also get genital warts and other diseases caused by different types of HPV. Moreover, men may also pass the virus to their partners. Therefore, only through universal vaccination can we break the chain of transmission and achieve herd immunity.
Can't get the third jabbing time. Don't be anxious. Mix and match of HPV vaccines not recommended.
The HPV vaccine has become a hot topic in recent years, with many young women getting the vaccination, and there were even sensible women from the mainland flocking to Hong Kong for the shot in 2019. However, after the outbreak of COVID-19, the quarantine-free cross-border travel has not been resumed so far, which make those mainland women who have not been fully vaccinated against HPV extremely anxious. According to the experts, 2 doses are sufficient for girls aged 9 to 14, and for women aged 14 and above who need a 3rd dose. The interval between each dose can actually be quite long, such as a year or 1.5 years, which also show the same efficacy. Studies show that among side effects of the HPV vaccines are only redness and pain in the arm where the shot was given, with a few people experiencing headaches and other symptoms. For some girls who are physically weak, they can stay at the clinic for an hour after vaccination. As for vaccine mixing, for example, after getting 2 doses of the bivalent HPV vaccine, can people get the 9-valent HPV vaccine for the 3rd jab? At present, There's no research on HPV vaccination, so it would be safer to receive third doses of the same vaccine.
Regular testing after getting fully vaccinated don't have the fluke mind. However, even if you have received HPV vaccine, you can't rest easy. Infection of high-risk HPV does not lead to any apparent symptoms. Therefore, if a woman starts having sex, she must have a cervical screening. Many people do not take the HPV testing seriously because they think they only have one sexual partner. But it is really hard to say. One may only just have one sexual partner at a certain time. But what about the exes? What about your partner? You just can't be 100% sure. Now, pap smear testing is mostly used for cervical screening, and high-risk HPV testing is also conducted in many places. Both procedures are very simple, in which one just needs to collect some samples from her cervix. Also, the whole process will just take several minutes, and you won't feel very uncomfortable. In this way, some shy women can take their samples at home, which can effectively increase screening rates, according to research. The earlier the HPV infection is detected, the better the chance of cure. HPV infection does not necessarily mean a disease. However, when a woman is unfortunately infected with HPV, even if no lesions occur yet, there's no way to eliminate the virus through medication for the time being. Even though there's an 80% to 90% chance that the body can eliminate the virus on its own, there's still a 10% chance that the virus will not be eliminated, and a persistent infection will lead to precancerous lesions.
If the lesions develop into cervical cancer, the overall 5-year survival rate is about 66%, with a 90% survival rate for stage 1 patients, but only 16% for those at stage 4. So the earlier it is detected, the better the chance of recovery. All women should go for a test after they start to have sex. Within the first 2 years, they should get tested once a year. And if everything is alright, they can then get tested once every 3 years until the age of 64. Hong Kong's Department of Health has launched a cervical screening program since 2004 to encourage women to receive regular screening for cervical cancer. By the end of 2020, however, only about 542,000 women aged 25 to 64 had enrolled in the program, accounting for only 21% of Hong Kong's female population in the corresponding age group. Experts suggest that the government should continue promoting the program and do more research to find out the reason why most women didn't join. The Hong Kong government needs to work on both vaccination and screening so that cervical cancer will no longer be a nightmare for female citizens.